our community. We're so excited to have so much interest in this topic. We had a lot of people register for today's training, so thank you again for making the time to be here today, and we hope that you gain a lot from the session today. We can move on to the next slide, please. All right, so for those of you that don't know me, my name is Yvette Salinas. I'm the Network Program Manager here at the National Center for Farmworker Health. I'm joined by Lisa Miller, who's the Partnerships and Symposium Manager at NCFH. Thank you, Lisa, for the backup support here on the tech issues that we were experiencing. At the National Center for Farmworker Health is an information service and training and technical assistance organization, and we're dedicated to improving the health status of farmworker families. So we're going to go ahead and jump into the topic for today. We will be learning, we'll go through the learning objectives. Just briefly, we're going to be learning about structural and social barriers that impact engagement with refugee and immigrant and migrant communities, and how these barriers can affect health outcomes and service utilization. We're also going to be discussing strategies for enhancing client interaction and service delivery to non-English speaking populations using interpretation. And then we'll also be learning how culturally responsive approaches can enhance cross-cultural service delivery. So those are our objectives for today. And then finally, I get to present Gabriel Sanchez, he, who's a Special Projects Director at the Texas RioGrande Legal Aid. Before Gabriel joined TRLA, Gabriel spent several years working with refugee and immigrant populations as a case manager, interpreter, and educator. Gabriel's role at TRLA has included doing outreach and increasing TRLA's sensitivity and awareness with working with different marginalized and underserved communities. And Gabriel has also has extensive experience providing trainings to nonprofits, service providers, and other organizations working with underserved populations. So I'm going to hand it over to Gabriel and let him do a brief introduction of TRLA. And we're so happy to have you, Gabriel. Thank you for sharing your knowledge with us today.
Yeah, absolutely. I'm really excited to be here, and I'm really thankful for all of you who are taking time out of your busy day to join us. I hope that this training is helpful for some of y'all. It's definitely not meant to be exhaustive. I think this could be a much larger conversation. There are college courses taught, in social work schools about this topic, and so it's definitely a much larger topic, but hopefully it's introduction to some key concepts. And I hope that some of you walk away with some concrete strategies that you can implement in the work you do to enhance your cultural engagement with diverse populations. This is very much informed by my experiences and my perspective, and looking at the people who registered. I think some of you could give this training as well, right? It may not look exactly the same, but I think a lot of you also have expertise and have maybe learned along the way some strategies that work for your particular community. So I just wanted to acknowledge that we have a lot of experience and a lot of strength and expertise in this room. I work for Texas RioGrande Legal Aid. We are a nonprofit that provides free legal services to low-income families and individuals throughout a specific area within Texas. We cover about a third of the state of Texas. And we work with clients with legal issues from over 45 practice areas, including family, employment, housing, and other areas of the law. We have one of our oldest and I think most important and most vital projects is our Farmworker team, which has earned a national reputation for its aggressive advocacy and our innovative strategies for achieving impact on farmworkers' rights. This was one of TRLA's first projects when we launched back in the 1970s, and it's continued to be a really important part of the work we do. We work with farm workers throughout Texas and regularly advise farm workers on their labor protection. So we do a lot of robust outreach to farm worker populations to let them know about their rights, as well as direct legal work and representation for issues such as wage theft, workplace safety, contract violations, and other issues affecting migrant populations. We also have our SNLS program, which is based in Nashville, Tennessee, that provides free legal services to low-income farm workers throughout a specific area of the Southeast, which includes Alabama, Arkansas, Kentucky, Louisiana, Mississippi, and Tennessee. We do work with underpayment of wages, retaliation, breaches of contract, employment discrimination, issues related to human trafficking, and other issues that commonly impact farm workers in this area. So now we're going to talk about, and if you want more information, you can always visit our website. It's www.trla.org. I know that a lot of you are outside of the service area that we directly serve, but we're always open to provide, insight or advice if you have any questions about working with this population. So now we're going to talk about cross-cultural engagement with your community. And I imagine that the majority of you are here because you work with diverse communities that consist of a lot of different cultures. And I think it's just really important to acknowledge that we need to be mindful of how we're serving different cultures, because if we're not mindful and we're not intentional, we run the risk of alienating certain cultures or of not reaching certain cultures. And in the kind of work that we do, it's really important. So Yvette already mentioned this, but a lot of this is informed by my work. After college, I worked at Lutheran Social Services in Phoenix, Arizona, as a refugee resettlement youth case manager. I also did a lot of interpretation work while there for Spanish, Swahili, Arabic, and Portuguese. I worked as a volunteer English teacher for refugees after that, alongside other jobs. And then I spent about 8 years working with unaccompanied minors here in the Rio Grande Valley, the majority of which were from Central America, but from all over the world. At TRLA, a lot of my work has focused on how we can bridge the gap with underrepresented communities within our service area and how we can make our services more accessible and inclusive. And I'm also a tribal language revitalization worker for 2 of my heritage languages. And I, love learning about different languages and cultures. And so I think this is really informed by those experiences. So again, we serve and work with diverse communities made up of different languages, cultures, and backgrounds. I think that a lot of people often assume that diversity is something you have to make happen. And while it's definitely important to take steps to make diversity and inclusion happen within a workplace or with our client populations and making sure we're serving everybody within a diverse community, diversity just happens. It exists. It's a natural fact of life, right? If we're doing this work, we are serving a diverse community, or we should be serving a diverse community. Our target population, our target communities are diverse, and that includes things like national origin, religion, ethnic identity, and language. Many immigrant and refugee populations have to navigate the dominant language and culture of the United States in order to access services. And that's just a reality, right? And historically, different cultures and populations have not always been treated equally. And again, that's just a historical reality, both in the United States and in other countries. So a lot of times, our refugee and immigrant populations are dealing with a history of different groups being treated differently within the United States, but they're also bringing, in many cases, histories and experiences from within their countries of origin where they may have been treated differently for belonging to a minority population. And so they already have that experience with stigma or discrimination or not being allowed to access certain services because of who they are. And we have to take that into account when we're working with them. So we're going to cover briefly some structural and social barriers that impact engagement with immigrant and migrant and refugee populations. So these are just some basic ones that sometimes feel like they're out of our control. A lot of things that prevent people, I know, from accessing legal assistance through TRLA, that may prevent people from accessing health services through a public health clinic or social services through refugee resettlement, are some very basic things that sometimes feel very out of our control because they're so structural. So there's lack of employment protection. Some people may not be able to get time off to go access services from places that are only open during the workday. In a lot of rural communities, there's not a lot of public transportation that's accessible. That's definitely the case here in the Rio Grande Valley where I live. A lot of people lack stable housing, and that can impact their engagement with services. I know that I have a lot of clients who kind of drop off the face of the earth when their housing becomes unstable. And I also work with people experiencing homelessness pretty frequently. And I know that that can be a big part of adhering to treatment plans, for example. There's also, in many cases, fears of law enforcement or immigration enforcement. Whether it makes sense for a person's situation or not, a lot of refugee and immigrant communities have a natural distrust of law enforcement, and they may be suspicious or hesitant to engage with service providers that they conflate with law enforcement, even if you don't work directly with law enforcement. And then there's a lot of people who don't have benefits, whether they're entitled to them or not, and may not think that they can afford the services that we're offering because they don't know that they might qualify. So those are some of the things that may feel like they're out of control, right? And we can do education and we can do referrals to bridge some of those gaps. These are things that as organizations may be a little more under our control. Some of these cultural barriers that we may be able to address more directly. So lack of interpretation and translation, lack of accessible material in native languages, outreach that doesn't take into account a person's language, lack of cultural awareness on the part of service providers has historically kept a lot of people from engaging with services. Experiences with discrimination or marginalization. Sometimes that's an individual has had an experience or a person is part of a tight-knit community and one or two people within the community had negative experiences with a service provider. And in those communities, especially if there are these small communities in the United States where there's only a few hundred people that speak the same language, the word can spread pretty quickly. And, that may make it really difficult to engage with that community. Lack of culturally and linguistic specific outreach efforts and materials can also keep people from engaging with services. And I do have a tendency to talk somewhat quickly. I'm trying to be mindful of that. We are not doing translation right now, so I can be a little faster, but if anybody's struggling because of the pace at which I'm talking, please let us know in the chat and we can address it. So we're going to talk now about some language needs and barriers and a little bit of historical and cultural context that may be helpful for the populations that you work with. So a lot of the populations that we work with do come from Latin America. Latin America is very multilingual. There's a tendency to think that everybody who comes from Latin America speaks Spanish, but that's not always the case. There are a lot of indigenous languages that have existed for thousands of years in Latin America that are still very healthy and robust and spoken by millions of people, some of whom are monolingual speakers. There are languages, other European colonial languages like English, Dutch, Portuguese that are spoken in Latin America. There are creoles based on colonial languages and the contact they had with indigenous and African languages. And they are mixed languages, and there are a variety of different pockets of linguistic diversity within Latin America that I think may be surprising to people. So it's difficult to capture all of that on one map. But these are some maps. This is one map that captures some of the current major indigenous languages of Latin America. And of course, there are countries that have a very small number of indigenous language speakers. There are countries like Mexico and Guatemala that have large populations. One thing that is different in Latin America than the common experience for a lot of people in the United States is that it's really common for a lot of people to be multilingual and for generations within a family to be multilingual. It's also common for people to speak two or more languages or to use different languages in different settings. So for example, the language you use at home or the language that you use at work. In places like the Mosquito Coast of Nicaragua, it's common for some children to be fluent in up to 4 languages, and they use those in different contexts, and that's been the case for generations. And that's something that you don't see as often in the United States, that we're not as used to thinking about in the United States. There are also people who are born and raised in Mexico or Guatemala or other countries and have lived there all their lives who don't speak Spanish at all because they don't need it in the context in which they work and live. And I think that that's also, you don't hear as often about people born and raised in the United States who don't speak English, although there are many. It's not as common, I think, or as visible as an experience. So in Mexico, which is responsible for a lot of the immigration that we see, and historically, a lot of Mexican immigrants have been a large part numerically of the farm worker population. The Mexican government recognizes 68 indigenous language families or groupings. Exact figures vary, but over 285 distinct languages are spoken in Mexico. The reason that the number is a little hard to categorize is that there are dialects of different languages that differ from each other. So for example, Nahuatl and Zapotec have multiple different dialects within their groupings that can be very different from each other, that aren't always mutually intelligible with each other. And so when you see numbers of indigenous languages spoken within different Latin American countries, there is a lot of variety in the estimates because some people count different dialects as different languages because they're so different from each other. And that's something that you need to be aware of if you're trying to find an interpreter, for example, for a Zapotec or a Nahuatl or a speaker. There are different dialects and they may not always be able to understand with or engage each other. So that's why there's 68 language families or groupings, but within that, there are a lot of different accounts of the different languages. And being within the same language family doesn't necessarily mean that the languages are all that similar. So if you look at the Utoaztecan language family, which is one of the largest language families in Mexico and also has languages within the United States, That includes languages like Comanche, Gabrielino, Cora, Huichol, Tarahumara, Nahuatl, and those are all very, very different from each other. There's very little in common that they have in terms of their vocabulary, but they are all within the same language family. Um, about 6% of the population of Mexico speaks an indigenous language. In the United States, there are substantial populations of Mexican indigenous languages that speak Mexican indigenous languages, including Nahuatl, Zapotec, Mixtec, Tzotzal, and Yucatec Maya, and Trique, and they come from states including Puebla, Guerrero, Hidalgo, Chiapas, and Michoacan. And these are some pictures of some indigenous language speakers, farm workers in the Rio Grande Valley. I actually was not aware that there were so many indigenous language speakers here in the valley, and these were actually taken by Yvette, who introduced us. Again, there's dialectical differences in Mexico that mean that within the same language groupings, there may not be a lot of intelligibility. On the right is a page from the Ethnologue, which is, I think, one of the most helpful resources. I have a blurred, so you may not be able to see it, but it's a book that has information on all of the world's languages, and there are multiple, for example, dialects of Zapotec or Nahuatl listed within there. In Guatemala, around 55% of the population self-identifies as indigenous, and anywhere from 40 to 60% of the population of Guatemala speaks an indigenous language as a first language. There are 25 indigenous languages recognized in Guatemala. 22 of these are Mayan languages, and the other two are Xinca, which is a dormant language that is undergoing revitalization, and Garifuna, which is also spoken in other Central American countries and is a blend of Carib, Arawak, West African languages, and English. And there are a lot of Garifuna-speaking immigrants in the United States from different parts of Central America. There is no single Mayan language, and that can be confusing for people. A lot of times people will even say, they may say, I speak Maya. That doesn't mean that you know anything about what language they speak, besides the fact that it is within the very large and diverse Mayan language grouping. Languages that are Mayan include Huastec, Cho, Quiche, Yucatec Maya, and they don't have a lot in common in terms of vocabulary. And then even within specific Mayan languages, there's a lot of dialectical variation because they're not always standardized, which means they don't have a specific standard written system. There are dialects of Mam, for example, that are not intelligible with each other. During the Guatemalan Civil War, and this is from another book that I find really helpful called Language City. During the Guatemalan Civil War from 1960 to 1966, US-backed military dictators decimated Mayan communities, leading many to hide their identities. Violence and poverty in the country's highlands are still causing migration, people to flee, including unaccompanied minors, to the point where Mam, Quiche, Canjobal, Quechua, and Cactiquel are now among the languages most commonly encountered at the US-Mexico border. And so I think that's also really important because a lot of these populations aren't fleeing just for economic benefits. There are structural barriers to them living the same quality of life as their non-Indigenous counterparts in these countries of origin. And you also may have to deal with that these people may be used to encountering prejudice because of the language they speak, and there may be some hesitancy to state their needs for interpretation. I encountered that a lot when I worked with UACs. There were a lot of youth from Guatemala whose main language was an Indigenous language, who may have had some limited proficiency with Spanish, but they were really hesitant to admit that they needed an interpreter because of a fear of discrimination. And it wasn't until after we built a rapport with them that they would say, I'm much more comfortable speaking in Mam, or I'm much more comfortable speaking in Quechua. You may hear Mam speakers say things like, yo hablo el Mam uno y él habla el Mam dos, like I speak Mam one and there's Mam two. There are actually multiple dialects of Mam, and colloquially, they're sometimes grouped as Mam one and Mam two, but there are much more varieties than that. Mayan-speaking enclaves in the U.S. exist in places like Jupiter, Florida, Indian Town Village in Martin County, Florida, in rural Nebraska, in Collinsville and Albertville, Alabama. And most of those enclaves resulted as a result of waves of migration finding opportunities within agricultural work in those areas. And this is a quote from a story written for the Dallas News. When Spanish-speaking immigrants from Latin America arrive in Dallas, they face hurdles, but hardly anything is insurmountable. Spanish is widely used by hundreds of thousands of people, but those who speak only or primary indigenous languages suddenly find themselves lost and isolated in a city that doesn't understand what they say. And I think that is a really important perspective. We know that it's difficult to be an immigrant or a refugee, no matter what, but a lot of people speak languages where it's very easy to find services that tailor to them. It's very easy to find interpreters. They may even be resettling into a city where there are signs and whole neighborhoods that speak their language. But if you speak an indigenous language, it can be a lot harder to overcome some of these barriers. So while it is really difficult for somebody who is a monolingual Spanish speaker to access services, to find a job, to acclimate into their new environment, it's even harder for people whose language isn't as widely used or understood. In El Salvador, there are indigenous language speakers as well, even though they're not as visible or as numerous in places like Mexico and Guatemala. Nahuatl is the most spoken indigenous language in El Salvador, and there are still monolingual speakers that exist. Nahuatl is related to, but not identical to, the Nahuatl spoken in Mexico. And within Latin America, there's a tendency to conflate indigenous identity with language use, and that's something that you'll still encounter a lot. So there are people who will say, I'm not indigenous because they don't speak an indigenous language, even though both of their parents and all four of their grandparents were indigenous. That is a really common mentality that I think younger generations are moving away from. But I would encounter it sometimes when I worked with UACs where, we were trying to find out if there was any discrimination as a basis for legal relief. And we would say, well, as an indigenous person, and they said, well, I'm not indigenous. And I'm said, but, your parents spoke Canjobal. And they said, right, my parents are indigenous. I'm not. And so a lot of times indigeneity is marked by and defined by the use of an indigenous language. And if a person no longer speaks an indigenous language, other people may not perceive them as indigenous in Latin America, and they may not even perceive themselves as indigenous, despite that being the culture from which they emerged. And this is very different from how we view indigeneity in the United States and Canada. And so it's something to be mindful of and aware of. There's two examples that I think are really helpful. The examples of Salvadoran Nahuatl and Huachichil. So there are a lot of people who will say that there are no more Nahuatl people in El Salvador. And what they actually just mean is that there's no more speakers of Salvadoran Nahuatl. Even though there are a few, there's been a common narrative within El Salvador that there are no more speakers. The Huachichil are an indigenous tribe within central Mexico from states like San Luis Potosí and Zacatecas. And for years, they were regarded as extinct by the Mexican government because their language went extinct relatively quickly. By the 1600s, there were no longer any fluent speakers of Huachichil, but there continued to be enclaves and communities that very much identified as Huachichil and maintained their cultural identity, but they were not viewed as indigenous by the communities around them because they did not speak a separate language. And it wasn't until this last census that the Huachichil people were identified as an indigenous people within Mexico again. And again, their identity had survived, some of their cultural practices had survived, but because their language was no longer marking them as separate from their mestizo neighbors, they were not viewed or recognized as indigenous people. And just as a reminder, linguistic diversity may not always look like what you expect. So two common languages that we needed interpreters for when I worked with unaccompanied children were Garifuna and Miskitu. Both the Garifuna and Miskitu populations are the result of contact between enslaved Africans and indigenous people who united in order to survive colonization. In the case of the Garifuna, they are both, culturally and linguistically, as well as biologically, a blend of African and indigenous contributions. The Garifuna language has words from Carib and Arawak and a lot of West African languages, as well as French and English and Spanish. It is a true blended language, and it is unique in that way in a lot of the countries in Latin America where Garifuna is spoken. There are large Garifuna populations in the Bronx, in Queens, in New Orleans, in Los Angeles, and there are growing Garifuna populations in a lot of agricultural communities or communities that attract agricultural workers. But a lot of Garifuna look racially Black. And so people may not expect them to need an interpreter because their idea of a Latin American person who needs an interpreter is someone who looks more stereotypically or conventionally indigenous. And the same is true for the Miskitu. In the case of the Miskitu, they incorporated large numbers of escaped enslaved Africans, but they retained the indigenous Miskitu language. And so there are a lot of people who racially may be more African than indigenous, but speak an indigenous language, which is Miskitu. And there are a lot of complex dynamics at play in the way languages are used and regarded within Latin America. And so one example I wanted to touch on briefly is the example of Chichimecajonas and Nahuatl in Guanajuato. So these languages coexist and border each other in the Mexican state of Guanajuato. and there are revitalization and preservation efforts underway for both. However, Nahuatl tends to be viewed with a lot of prestige because it's associated with the ancient Aztecs, and it's viewed as this beautiful language that was the language of poetry. And Chichimeca Jonas is spoken by just a few hundred people, and they are not viewed in the same way. The word Chichimeca itself was often used as a derogatory slur, and their language is very, very different from Spanish. With vowels that are very difficult for Spanish speakers to say, and tonality. That means a lot of times they sound like they're making noises or sounds that are very foreign to Spanish speakers. And so it's not viewed with as much prestige. And because of that, there have been a lot more efforts to preserve Nahuatl. And there is a lot more pride in being a Nahuatl speaker within this region. Obviously, that's complex, whereas being a speaker of Chichimeca Jonas is still seen as not as desirable. When you're talking about languages in a Latin American context, it's important to be aware of the fact that a lot of times languages have been, indigenous languages have been referred to as dialectos or dialects. A dialect is a variation of a language. It's a variant of a language. Lots of languages have multiple dialects, but the tendency to call indigenous languages dialects is viewed by many as disrespectful because it's reducing the indigenous language it's making it sound more simplified, less important, and less valuable than Spanish. Indigenous languages are languages; they have dialects within them, but there's a growing awareness within Latin American countries to not call them dialectos. And in fact, I've heard people who get really offended when someone says, hablas el dialecto náhuatl. Well, it's not the dialecto; it's an idioma. But a lot of times you'll still hear people talk about, for example, their indigenous ancestors or indigenous people they knew, and they'll say, and this happens in my family, my great grandmother spoke an indigenous language, and they'll say, hablaba su dialecto, right? Well, she didn't speak a dialect, she spoke a language, right? And so just be mindful of this tendency and be mindful of what what attitudes are being conveyed with this. So it's best to say idioma or lengua as opposed to dialecto. There are a lot of language stigma, a lot of language stigma and linguistic prejudices within Latin America that we've already discussed somewhat, but just to share some statistics that put it into view, 75% of indigenous language speaking families in Mexico live in extreme poverty. In 2020, the group with the highest poverty rate was indigenous people with a rate of 82%. And indigenous people in both Mexico and Guatemala are more likely to leave school at young ages and experience landlessness, malnutrition, and internal displacement. So there is still a lot of discrimination socially and then structurally with things like employment and healthcare for people who speak an indigenous language within Latin America. Even as there are sort of this like symbolic overtures made by some Latin American countries to celebrate their indigenous heritage, it's very much a celebration sometimes of the indigenous past without any investment in uplifting or celebrating or helping present day indigenous people. Creole languages are also common throughout Latin America. And a Creole language is a language that was born out of a colonial contact situation. It is usually a blend of a colonizer's language, usually a European language, with the languages spoken by the people who were peoples who were colonized. And so a lot of Creole languages in Latin America may have a high degree of vocabulary from Dutch, Spanish, Portuguese, or English, but then also a lot of grammatical and lexical influences from the languages of the people who were enslaved or colonized, whether they were indigenous or African or both. So these are public health signs or just signs in some indigenous languages. This is one that says "Putan yo mas, keep your distance, wash your hand them," and that's in San Andres and Providencia Creole, which is spoken in Colombia. And then show your sorry, let me move this real quick. Show your love for the barefoot them, noto trash in a fowy sand, and that's in Mosquito Coast Creole. And then, or sorry, in Belizean Creole, but it's very closely related to Mosquito Coast Creole. And then there's a public health sign in Haitian Creole. There's a tendency sometimes, even within speakers of these languages, to think of them as broken or substandard English. But there's a growing awareness of how that's not the case. They are languages in their own right, and they should be treated as such. And sometimes that means acknowledging that there may be interpretation needs for Creole-speaking populations within the United States. For example, speakers of Haitian Creole, which I think has more awareness as its own language, but I think in the US, we're still in the process of recognizing English-based Creoles as distinct languages. For example, Jamaican Patois. Haitian Creole is an example of a Creole language that is the dominant language of its country. And I think there's an awareness that Haitian Creole is very distinct from French. Sometimes I still run into people who think, well, if they speak Haitian Creole, then all we need is a French interpreter. And that is not the case. Haitian Creole is, uh, has a lot of vocabulary from French, but it also has a lot of West African grammatical influences and some indigenous words as well, and is very different from standard French. And a lot of Haitian Creole speakers have a hard time understanding standard French because they're different languages, right? Linguistic diversity may not always look like what we're expecting. In the case of migrant farm workers in the US, in the 70s and 80s, there were a lot of people doing farm worker outreach along the US-Mexico border and in the communities of around Eagle Pass and Brackettville in South Texas. They were encountering people who surprised them because they did not speak Spanish, but they also did not speak English. Both the Kickapoo and the Black Seminole have a long history of crossing the US-Mexico border at different times to maintain their freedom, their agency, and their way of life. Both communities have maintained their languages despite traveling great geographic distances. And so now in northern Mexico and South Texas, there are a lot of, still to this day, monolingual Kickapoo speakers. In the 1970s, the Kickapoo are originally from the Great Lakes region of the United States, and they migrated over the course of centuries into South Texas and then into Mexico to preserve their way of life and avoid the US reservation system. There are still many monolingual Kickapoo speakers to this day, although now more and more of them are elderly. And in the 1970s, because of a drought in Mexico, many of them who did not at the time have federal recognition as American Indians became migrant farm workers in order to survive and support their families. And so people working with migrant farm worker populations were all of a sudden running into people that they thought were Mexicans who spoke Spanish, but they were actually Kickapoo who spoke Kickapoo. And that presented a challenge to a lot of public health workers or legal law workers. Afro-Seminole Creole is spoken by the Black Seminole, who similarly fled into South Texas and Mexico to preserve their way of life and their freedom. It's not as widely spoken as Kickapoo to this day, but there are revitalization efforts underway. I'm one of the people involved in our language revitalization project, but it is very distinct from English. At the time, though, educators, social service workers who were working with this population just thought that they spoke bad English and treated them as such, right? They didn't think of it as a language that required its own interpretation needs, even though it is very different from English. So, for example, "Abenayedi se huna ende in bracket" says, "I heard that you are going to be in Brackettville." That's very different. There are African words in there. There are African grammatical structures in there, as well as indigenous words in there. So it is not English, but a lot of times people had a hard time understanding that. And we still see that with Creole languages today. So now we're going to talk briefly about refugee languages within the United States, some common ones spoken by recent waves of refugees to enter the United States. In Iraq, most people speak Arabic, which is the dominant language, but there are a lot of different dialects of Arabic that don't all understand each other. They're not all mutually intelligible. The Maghrebi dialect of Arabic, which is spoken primarily in North Africa, is often unintelligible to people from the Levant, the Gulf, and Egypt. A lot of the media that is produced in Arabic comes from this side of the Arabic-speaking world. And so North Africans actually have a much easier time understanding, for example, Lebanese Arabic or Egyptian Arabic than a Lebanese or Egyptian person would understanding North African Arabic. There is a dialect of Arabic that's modern standard Arabic or Fusha, which is the one a lot of people learn in school. But if you don't have access to formal education, you may have a harder time speaking or understanding Fusha or modern standard Arabic, and you may feel more comfortable in your dialect of Arabic. There are also a lot of minority languages in Iraq, like Aramaic, Kurdish, Judeo-Arabic, Damari, where the speakers may have hesitancy to state their language needs because of histories of discrimination. In Burma, which is one of the refugee populations I worked with a lot when I worked in refugee resettlement, the majority of the refugees that came from Burma about 10, 20 years ago did not speak standard Burmese. They spoke languages like Karen, Karenni, and Kaya, all of which are not standardized, meaning there are not, common ways to write them. There also was a lot of dialectical variation, not just from region to region, but sometimes from village to village. And it could be very, very difficult to find interpreters for these languages. In Eritrea, Somalia, and Sudan, there are a lot of minority languages spoken, and these people are often discriminated against by the majority population because they are viewed as more African or more traditional, and so they may have a stigma with expressing their language needs. So, for example, in Sudan, Now, South Sudan, there are speakers of Masalet and Fur. And in Eritrea, one of the most challenging populations that we worked with because of the lack of interpretation were the Kunama, who were a small minority that often lived in rural Eritrea and were often encountered discrimination from the rest of Eritreans. So I actually learned how to say just a few basic sentences in Kunama just because we couldn't find interpreters. We would always eventually find an interpreter, but sometimes it could take 2 or 3 weeks to schedule it. And just to kind of get some very basic concepts by, some of us learned Kunama because it was really hard to find speakers of it. We still see a lot of agricultural workers that are from the Democratic Republic of the Congo. There's a lot of linguistic diversity in the Congo. There are lingua francas in the Congo that are spoken by large chunks of people, but they're not all spoken by everybody. So French, Lingala, and Swahili are all viewed as languages of common communication within the Congo, but none of them are spoken by everybody in the Congo. So some people may speak French and their ethnic language. Some people may speak Lingala or Swahili and their ethnic language. So you may have the option of finding one of these more common languages to speak to them, but of course there are people that only speak Kikongo or Kinyarwanda, right? In agricultural context, this linguistic diversity, which I would argue all diversity is a great thing, we should keep and preserve languages as much as we can, it can make the work we do really difficult. So the Smithfield pork processing plant in North Dakota got a lot of attention during the COVID pandemic because there were over 45 languages spoken there. The majority of the workforce were refugees and immigrants. There were languages like Somali, various Guatemalan indigenous languages, Tigrinya that were spoken, and that made it really, really challenging to get any kind of public health messaging out in an efficient manner. And when you're dealing with something like COVID that is rapidly evolving and our understanding of it is rapidly evolving, it can be really crucial to get information to people as quickly as possible. But public health workers, as well as the people who ran the factory, were really struggling with getting updated information to everybody because there were cases in which someone spoke a language and they were the only person in that factory who spoke the language, or there were only 2 or 3. And so there were a lot of negative effects of this because a lot of people suffered from exposure to COVID and had no idea what to do, how to seek treatment, how important it was to isolate, and just kept on showing up to work because they didn't have the access to any of this information within their own languages. There's also been a lot of articles and pieces written recently about how difficult labor organizing is in some agricultural contexts where over 50 languages are spoken and maybe 1 or 2 people speak the same language. And just remember that reality is a lot more complex than the narrative. Most undocumented agricultural workers speak Spanish, about 93%, but a smaller number speak English, 4%, and then 2% speak South or Central American indigenous languages. None of these come as a surprise, but the Center for Migrant Studies put out a list of the most commonly spoken languages by undocumented agricultural workers. And after these common ones, it was German, Tagalog, and Afrikaans, which definitely surprised me. This is not what I was expecting. And the reason for that is, so Filipino immigrants have a long history of working in agricultural industries. I'm not going to get into the recent news about Cesar Chavez, but one of the things that came up was that, his legacy often erased the contributions of Filipino agricultural workers and their contributions to the farm worker movement. But Filipinos have a long history of working in agriculture, and a lot of Filipino immigrants on the West Coast continue to work in agriculture, and that accounts for Tagalog. German-speaking Mennonite communities, originally from Europe, went to Canada, and then in the early 1900s relocated to parts of Latin America because they felt that the Canadian government was trying to force them to give up their distinct way of life. And today, there are Mennonite communities in Mexico, in Argentina, in Venezuela, in Paraguay that continue to speak a variant of German called Plattdeutsch. I don't think I'm saying that right, but it's very different from standard German. It retains a lot of archaic features. And today, a lot of these people are coming from Latin America into the United States to find work. And now there are Plattdeutsch speaking communities from places like Mexico and Paraguay in Pennsylvania, Ohio, Indiana, and Virginia. And then Afrikaans is a language based on Dutch, but very different from standard Dutch, spoken in South Africa by white South Africans of Dutch descent, but also by mixed race communities like the Cape Colored community. And it is very much a healthy, robust language in South Africa that has survived the introduction of English. And there are a lot of Afrikaans-speaking workers that have entered the United States since 2011 from South Africa. And a significant number of them entered in 2024. And this may surprise people. They may not be expecting to see, blue-eyed, blonde-haired white people speaking languages related to German and Dutch in agricultural contexts. Really quickly, we're going to cover some federal language access protections under Title IX of the Civil Rights Act. So, language access was first brought into law with the Title IX of the Civil Rights Act of 1964. It did not explicitly specify language access, but it does prohibit discrimination on the basis of race, color, sex, age, disability, or national origin. And so a lot of people said that that included language because national origin should include language, but it was not explicitly spelled out. In 1974, the case of Lau v. Nichols, uh, in which the Supreme Court ruled that schools must provide special instruction to students who don't speak English, asserted that the Civil Rights Act also applied to language access. That was what the Supreme Court, their decision was based on an interpretation of the Civil Rights Act. And so it made it more clear that the Civil Rights Act included language access. Executive Order 13166 also requires all federal agencies to provide meaningful access to their programs and activities for individuals with limited English proficiency. It requires any public entity or government body receiving federal funding to have a language plan, to have accessible and visible notices posted about the availability of interpreters, and to provide training to all providers about how to deal with linguistic diversity or limited English proficiency speakers. The Affordable Care Act, Section 157, dictates that all healthcare programs and providers cannot deny access on the basis of race, color, sex, age, disability, or national origin. That includes language. Then all of these language access laws are meant to be comprehensive. They cover simultaneous oral interpretation, written translation, timely communication, right? So that you can't say, well, I didn't talk to them for 6 months because I couldn't figure out what language they spoke. That's not really acceptable. Qualified professional interpreters, whether it means you have them on site and they're part of your staff, or you plan in place to reach them through something like a language line, and then information available in multiple languages. Language access laws are meant to cover a wide variety of service providers. That includes hospitals, healthcare providers, and health facilities that receive any amount of reimbursement through Medicaid or Medicare, federal funded programs providing social services, or any business or nonprofit providing public services. So this means people with limited English proficiency are entitled to interpretation in their native language, material translated to their native language, and inclusion in services regardless of the language they speak. So now we're going to talk about some of the challenges of refugee, immigrant, and migrant communities when it comes to not just language access, but other kinds of access. Some of these needs may be medical, legal, or social. I want everyone for a minute to just imagine what it would be like to have to do one of these in a language that you don't speak. Apply for SNAP, file for unemployment, enroll your child in school, review a contract, get an appointment, fill a prescription. I recently was diagnosed with and prescribed medication for ADHD. The entire process was very cumbersome and time consuming, and I can't imagine having to do it in a language that I don't speak well or a language that I have no familiarity with. I have a special needs child who receives a lot of different services. And again, it's overwhelming as it is sometimes. It would be very difficult for me to have to do it with providers who don't understand what I'm saying, right? Some medical needs can include interpretation for doctor's appointments, scheduling follow-up appointments, translation for documents like vaccination records, linguistically appropriate education about workplace-related injuries, and education about preventative measures in both verbal and written form. So for farm workers, that may be COVID-19 information about things like heat stroke or sunstroke, information about pesticides needs to be readily available in different languages, and it isn't always. Legal needs can include court-based interpreters, know your rights materials for topics such as workplace protections and possible immigration remedies, translation for legal advice letters, and interpretation for intakes among legal service providers. So I saw that there were a lot of other people who work for legal service providers that had signed up for this. And a lot of times our services begin with an intake. We can't do anything without an intake. We can't provide advice, beyond like limited know your rights stuff without an intake. But how accessible are intakes if we don't have a plan in place for how people who speak different languages can access our intake services? So language marginalization refers to the fear, stigma, or prior negative experiences that may prevent clients from applying for services or communicating directly about their needs. Again, some of that is based in a fear in the US of being discriminated for speaking a different language. Sometimes we're inheriting cultural context from other countries in which someone may say, well, if I say I speak Mam or I speak Hunama, people may discriminate against me because that's what happens when I do it in my country. So now we're going to talk about some best practice tips and common challenges when working with an interpreter and what to avoid when you don't speak the same language as your client. So always use a trained professional interpreter for important communication. This is given, right? Except in very limited circumstances, you should always be using a trained professional interpreter for important communication, unless you have staff members that speak the same language as your clients. And I'll cover that as well, because there are some challenges that come with that. When working with an interpreter, it's really important to avoid idioms or slang that may be hard to translate from English. Avoid acronyms and avoid swear words. If you're going to use an acronym to refer to an organization, say the entire name of the organization so that the interpreter can find a linguistically appropriate way to interpret that. But saying, I'm going to refer you to TRLA, TRLA, and then someone hearing, te van a referir a TRLA, well, what's that, right? Whereas if you say the entirety of the name, the person can have a way to understand what services they offer. Use short, direct sentences and take frequent breaks. And that's something I struggle with when I'm working with interpreters. If it seems like the interpreter is taking longer than expected to explain something, or the client is asking questions that the interpreter is responding to directly and they're not translating it, they may be having a side conversation. It's okay to interrupt the interpreter and ask them to explain what's going on. You want to keep control of the conversation. The client may feel more comfortable talking directly to the interpreter because the interpreter is the person who speaks their language. And oftentimes, especially for minority languages that are less widely spoken, maybe someone from within their own cultural background, and so they feel like they want to talk to that person. But you want to make sure you're maintaining control of the conversation. If it sounds like they're having their own conversation, you want to bring it back to you. If they're asking questions directly of the interpreter, you want to know what those questions are because they may not be something the interpreter is primed to answer. And so you can say, can you summarize what you guys were just talking about? The best practice is to act as if the interpreter isn't there to the best of your ability. Use first-person communication, look directly at your client and not at the interpreter, right? You want to make sure that it's a conversation between you and the interpreter. And so you want to make sure that you're acting as if the interpreter isn't even there. A good example is to say, my name is Gabriel Sanchez, and today I'm going to talk to you about some resources that may be able to help you with healthcare. So again, you're addressing the client directly. The interpreter is just a bridge to facilitate conversation between you and the client. A not so great example would be to say, can you please tell him that I'm here to help him with resources, right? Because then you're putting a lot of onus on the interpreter to lead the conversation, to explain the conversation, and you're creating an additional barrier. So for both the interpreter and for yourself, you both should be acting as if you're speaking directly to the client and using I in first person. Reminder that some people may speak English but feel much more comfortable in their native language. Some people may speak the dominant majority or official language of their country of origin, but feel comfortable speaking in their native language, which may be a minority or a non-standard language. So for example, someone may speak Arabic just fine, but they feel more comfortable in Assyrian, or they speak Spanish, but they feel a lot more comfortable and they get it a lot more in Yucatec Maya. Do not assume that someone does not need an interpreter or that someone wants an interpreter from one specific language, right? Ask people what interpreter they want. Reminder that some less commonly spoken languages may need interpretation scheduled in advance, and this requires careful planning. So Mam, Quiche, Kunama, Kareni are all examples of languages that you may have to plan for in advance. So heritage speakers are very common in the work that we do. I'm a heritage speaker of Spanish. What that means is that I grew up speaking Spanish at home with my mother, and with my father to a lesser extent, and with my grandparents and a lot of my aunts and uncles. I spoke Spanish all my life, but I did not learn Spanish at school, and I did not ever have to use it in a formal context until I entered the workforce. The Spanish that I learned was very much Spanish at home, right? And so when I explain to people why I need to prepare to interpret certain things, like at work, I always have to tell them this may come as a surprise to you, but we didn't grow up speaking about wills and Todds or, affidavits of heirship at the dinner table when I was growing up. These are not things I have a lot of familiarity with, and it can be the same for medical procedures. One way to bridge cultural gaps is to hire members of the community that you serve. And that is increasingly a common practice for a lot of refugee resettlement agencies. When I worked in refugee resettlement agency, about half of the people were former refugees who were from the communities that we were serving. And that can be one way of ensuring language access because you're hiring fluent speakers to be case managers or to be public health educators. But remember that some contexts do require specialized interpreters. So this is a meme I found that I related to. It says, this person had to translate it in Spanish and they said, we're going to do an EKG on you. And I said, te van a hacer algo. And the patient asked, ¿qué me van a hacer? And I said, ahorita vas a ver. So for those who don't speak Spanish, they told me, please tell them that we're going to do an EKG on you. I don't know how to say EKG in Spanish. This person didn't either. And so they said, we're going to do something to you. The patient probably panicked and said, "What are you going to do?" And the only way they said, they were able to explain it was, "You're going to see in a little bit." Not very reassuring, not very inclusive, right? And so just remember that even if you are fluent in a language, sometimes you may need to learn different registers, or you may need to rely on a formal interpreter, like a medical interpreter that is suited to that specific context. Some language is technically correct, but may reinforce shame, stigma, or hierarchies. That includes abd in Arabic. Some words in Latin American Spanish to refer to racial groups may reinforce hierarchies. And then in the example of, I've heard people translate hijra, which is a gender-specific category in Hindi, but also exists in Nepal and in Pakistan and Bhutan. They may say eunuch because that's what their parents may have called them, but that's not appropriate because that's not how how these people actually identify. So formal register versus informal register. This is something that I learned again on the job. My first job out of college, I worked for a nonprofit that taught English to low-income Spanish speakers here in the Rio Grande Valley. We had a daycare for everybody attending the classes, and I was one of the only bilingual staff. And so the boss or the supervisor, who was not a Spanish speaker, told me, tell them that if the children make a big mess, it's important to clean it up. And I said, si los huercos hacen un desmadre, es importante limpiarlo. And then everybody I saw as all 20 people I had just told looked horrified because this is very informal. It uses words that may be viewed as, inappropriate, but I was talking like my mom would talk, but like my mom would talk at home, not necessarily how my mom would talk at her job, right? And so I learned very quickly that you have to get accustomed to using formal registers, even if that is a bit of a challenge for you. Some translation can exclude nuance, and that's also something to be mindful of. So I do a lot of capacity assessments in the work I do for adults with intellectual disabilities or developmental differences to try to prevent unnecessary guardianships. And sometimes that involves helping attorneys do capacity assessments by providing interpretation. So I remember providing interpretation for a client with an intellectual disability. And one of the questions we ask is, what do you like to do? Just to get a sense of how much the person can communicate. And they said, well, I like to go to the center that I go to, and I like to play loteria. So I turned around and I translated that as she likes to play bingo. Loteria and bingo are two very different games. Loteria is common in Mexico and other Latin American countries, and it has these very fanciful pictures that can be kind of, some children find them traumatic. My grandma was like the loteria queen of her neighborhood, and so I grew up, with loteria. Bingo is just numbers, right? And so they're played in a similar way, but they're very different games. And so the client corrected me and she said, no, I don't like to play bingo. I like to play loteria. Bingo is on Thursdays, loteria is on Wednesdays. And so that was really important, right? Because it also showed how much capacity she had. But it's important to catch ourselves when we're kind of flattening nuance in translation. Whenever possible, seek input from the communities that you work with to ensure that differences due to dialect and context don't impact the efficacy of the materials that you're using. So just as a reminder, some less commonly spoken languages do not exist in standardized written form, and many minority language speakers may not be used to typing or reading in their language. So you can think out of the box and deliver messages in things like video, voice note, or audio form, right? Some languages are written in script that are not easily replicated on computers or cell phones. Some people, their language is mostly oral and they're not used to writing or reading in it. And so if you need to deliver things like public health messages or know your rights, think about ways to do that through video or audio recording or through voice notes. I think a lot of times we think that public health information always has to be written, but there are ways to do that out of the box, right? And you can still work on providing written ones, even if that takes more time, but also have this for people for whom the written form is not as accessible. There's a common phenomenon called community interpreters, and this is again from the book Language City. It talks about a woman named Rasmina, who is a speaker of a Nepali language called Seke, which is only spoken by a few hundred people. And it said Rasmina is almost an unofficial unpaid interpreter and ambassador between her community and America. Like so many 1.5 generation kids in other communities, anytime a mom has an appointment, they'll call me, she says, I'll just speak like I'm the mom. She took her whole extended family to vote in the last election. She helped supervise 4 Seka kids as they struggled with remote learning during the pandemic. For others, she fills out unemployment forms, deals with repairs, translates prescriptions, and goes to parent-teacher conferences, either with or instead of the parents. So Rasmina, in this book, they talk more about her. She is one of the only bilingual English Seka speakers in this community in New York. And so she gets called on to do all sorts of labor that isn't really, she may not be necessarily trained for and isn't part of her job. And these people come to play important roles within their communities. And so it's important to remember, work on formal language access, work on having interpreters, but, recognize the importance of people like this as well. And if someone feels comfortable bringing someone like Rasmina with them, you can give them that option while still providing a formal interpreter. And then family interpreters are also very common. We definitely want to avoid that. We don't want to put a child in a position where they have to translate important information to their family members. This is a really common experience for children of immigrants, but because one, we can't ensure the accuracy if a child is having to explain complex concepts. We also don't know how that's affecting the family dynamic, and we want to be mindful of that, right? So avoid using children as interpreters, except in rare emergency situations. And again, that's due to the risk of inaccuracies. One reminder, though, is that in Western contexts, healthcare is very much an individual thing, whereas in many non-Western contexts, it's a family thing. So people can bring their families with them as long as they're comfortable and you're making sure that they want that, but they don't. That doesn't mean the family has to be the interpreter. And remember that all different dialects and registers are valid, and standard English is not everyone's default or goal. So it's important to confront implicit linguistic bias, right, that we may have about how people speak. If somebody speaks, for example, Appalachian English, we may have certain prejudices that come with that, or we may view them as ignorant or uneducated. And it's important to be mindful of that when we're working with diverse populations. So we're going to talk really quickly about cultural norms and health beliefs in a non-Western context, and then I'll stick around to answer questions once we're done at 2:15 if anybody has any additional questions. So many cultures and communities have their own medicine and medical practices that predate the introduction of Western medicine. And in some cases, these practices coexist along with Western medicine. And this can also be a barrier for people doing public health education in different communities. So culture influences the way people seek out treatment, adhere to treatment, respond to diagnoses, remain connected to providers, and understand illness. We can't do effective public health education without taking into account cultural differences. And that's just not linguistic, right? It's not just having a translator, it's understanding different cultural influences. So one example that I remember that I think illustrates this and why it's important to validate people's beliefs. It doesn't mean you have to agree with them. It doesn't mean you have to, say that the person is correct, but you can engage a person without correcting their understanding of something. So I remember when I was working with the UAC at ProBar, they said, "A mi papá lo mataron por envidia." We would always ask questions about whether any family members had been killed because we wanted to see if there was any possible nexus for asylum claims. And so this little kid said, "My father was killed because people were jealous of him." So, there I was writing away because I was like, this could be a potential asylum claim. This person's father was murdered. And then I said, "Well, how did they kill your father?" And they said, "Well, they killed him because they were jealous of him." And I said, "Well, why were they jealous of him?" "Well, because he made more money than a lot of people." "Okay, well, why did they kill him?" "How did they kill him?" "Well, they did brujeria on him, which is witchcraft. And he got a tumor, and the tumor grew and grew, and the tumor in his stomach killed him." And so this kid's father had actually passed away from a stomach tumor or stomach cancer, possibly. But in his view, this was caused by envidia, and his father was murdered. It wasn't my place to correct him and to tell him that that wasn't the case, but it was my place to both note how he described the situation and also what happened, right? In a lot of Latin American cultural contexts, a lot of illnesses are attributed to things like mal de ojo, espíritu, brujería, frío, those are common causes for certain illnesses that people may attribute to what they're suffering from, right? The goal is to move towards an understanding that traditional remedies can coexist along with more modern Western medical interventions. Communities may feel more likely to engage in public health education efforts and adhere to treatment if they feel as if their beliefs are being included instead of rejected or mocked. In the Rio Grande Valley, there are a lot of yerberias, right? There's a lot of traditional curanderismo that has survived for generations despite American and European colonization. And it's really common in a lot of Latin American countries for plant medicine and for folk healers to coexist along with Western medicine and to sometimes be more trusted than Western medicine. Some people engage with traditional medicine as a sense of last resort when they feel that Western medicine can't do anything more for them. Some people supplement traditional medicine with Western medicine and engage with both. I have friends that are my age that still see curanderos regularly, but then also go to therapy or to their doctor. And then there are contexts in which individuals and communities have ongoing relationships and may trust traditional medicine providers more than Western medicine providers. Plant medicine rooted in traditional knowledge can be an effective complement to Western medicine. So for example, in a lot of Latin American cultures, tole, which is like a cornmeal drink, is viewed as vital after you give birth. You have to drink atole or you won't be able to produce chest milk. There's not a lot of scientific basis for that, but it doesn't hurt to let people do that if they feel that that is going to help them and they feel that that's a way of maintaining cultural practices. Mesquite can be traditional medicine that can reduce diabetes, diabetic symptoms in some people when you use it in place of flour or sugar. That doesn't mean to stop taking your diabetic medication, right? Those are just two examples. But plant medicine can also, just because something is plant medicine doesn't mean it's a placebo with no side effects whatsoever. And I think that that's a danger that some people face, where they think that because something is plant medicine, it won't have any contraindications with Western medicine. So hibiscus or jamaica can be used to manage fever or nausea or as a diuretic, but it can also induce early labor. Oregano is traditional. My grandma used this whenever she was sick. It increases the immune system, and there's a scientific basis for that. But it can also increase bleeding risks before surgery. Chamomile or manzanilla can be used as a sleep aid or to calm anxiety, but it can also prevent the absorption of iron, and that can be very dangerous for people who are anemic or taking medication that may make them more prone to anemia. And willow bark or souse can provide pain relief, and but it can also cause ulcers or blood thinning, and it's dangerous for people with an aspirin allergy. So again, just because it's something is herbal or traditional doesn't mean it doesn't have real consequences, right? So it's important to have conversations with people about the herbal remedies that they're engaging with, not only to validate their cultural practices, but also to ensure treatment efficacy, right? So there are cultural and biomedical benefits to taking into account a person's herbal or traditional the treatments that they're engaging with. Some traditional remedies can be harmful, right? And it's important to have that conversation with people in ways that are respectful. So, among the Black Seminole in Vacaville and in other cultures, wounds were often treated with cobwebs, and people would collect cobwebs in case that there were wounds. And faith healers would have, big stores of cobwebs that they'd collect for those kind of occasions. But that can actually lead to infection. It's not very healthy, right? So it's important to be able to have those conversations in a respectful manner. And differing cultural perspectives and ongoing conversations are really important. I want to use the example of fry bread really quickly. And fry bread is a food that has been used in a lot of Native American communities for almost, for 100, 150 years. It grew out of the reservation relocation era when people were given limited rations and had to learn what to do with them. It's delicious. It tastes kind of like a flour tortilla, but deep fried. And it's something a lot of people look forward to at powwows or other cultural celebrations. But there's been a lot of growing conversations in Indian country about returning to traditional foods to counteract certain epidemics like diabetes, right? That tend to disproportionately impact Indigenous Americans. And so a lot of people are saying, well, fry bread is not a traditional food. We need to return to traditional foods like mesquite or acorn that are healthy. Fry bread is not healthy, and it actually can make diabetes worse if you eat it regularly. And so a lot of public health efforts talk about moving away from fry bread and moving towards more traditional foods. But fry bread also holds a very special place for a lot of Native American communities because it's a symbol of resilience and cultural adaptation and sort of common experiences that unite a lot of different Indigenous people from different cultures. And so it's important to have conversations that, respect that. For example, fry bread is a sometimes food, maybe at powwows or celebrations, but not every day, right? And so it's just an example of how none of this is clear cut. And these public health conversations involve living, breathing communities that are constantly changing and evolving. And these are dynamic conversations that are still happening in real time, right? And it's important to be mindful of those differences. So I'm going to use as an example from the Rio Grande Valley that I think spells out the benefits of engaging with traditional medicine. We started about 5 minutes late, so I'm going to ask if anybody can hang on for about 5 minutes. But if you have to go, want to be respectful of your time, please fill out the evaluation, and then I'll stick around for questions as well. So the Rio Grande Valley, where I'm from, is 4 counties that are among the poorest counties in the country. They are on the U.S.-Mexico border. They have a long history of being underserved and marginalized in different ways, and they are primarily made up of rural communities and immigrant populations or second-generation people or communities or families that have a long presence in the region, but still speak Spanish and adhere to Hispanic or Mexican-American beliefs. It is a very culturally conservative area, even today, where the Catholic Church still plays a very large role in how people view and perceive the world around them. So when and this is part of a project, I learned this through a project that I do documenting queer and trans histories in the Rio Grande Valley. And so I'm going to wear that hat for a second because I think this is a really powerful illustration of the benefits of engaging with traditional medicine. So when the AIDS crisis first hit the Rio Grande Valley, it was very difficult to reach people. There was a lot of stigma around having HIV because it was associated with queer populations. A lot of people did not want to seek out treatment. A lot of people lived with their families who were not aware that they were gay or bi or men who had sex with men. And so they were hesitant to seek out testing and treatment, and that was a very challenging barrier for public health workers who were trying to spread information about prevention and testing. So the Valley AIDS Council opened in 1987, but it was really difficult for them. That was the first formal response to the AIDS crisis in the Rio Grande Valley. It was very difficult for them to reach or engage with people because of these stigmas and this fear, right? When people who had developed AIDS-related complications were engaging with the medical system locally, they were often met with discrimination. Nurses that didn't want to touch them. There are a lot of horror stories of hospitals that wouldn't take trays of food in, and family members or volunteers had to come in and do it. People who refused to bathe or touch or even be in the same room as people with AIDS, whether that was nurses or doctors or other, CNAs. And so a lot of people also were hesitant to, and this is a story that is repeated often, they were hesitant to get tested because then that meant they were going to go to these hospitals where they were going to be treated as subhuman. So a lot of people tried to use traditional culture as an outreach method to try to spread the word, but they were still missing a lot of these people who just didn't want to have these conversations. But there's a long tradition of curanderismo and of yerberias in the Rio Grande Valley. And two of my great grandparents were curanderos. And people often go to curanderos before they'll go to a doctor, not just with HIV and AIDS, but with lots of different illnesses, right? And even mental health stuff. And there were specific rituals developed around certain orishas or certain faith medicine figures dedicated to curing people of AIDS or alleviating AIDS-related symptoms. And so a lot of people were going to their yerberias or their curanderos when they were coming down with AIDS-related complications instead of seeking treatment from a hospital or going in to get tested, right? So what the Valley AIDS Council did was start working with curanderos because they knew that people trusted them in the community. So one of the former directors of outreach for the Valley AIDS Council shared this with me during an oral history interview. We started working with the curanderos at Valley AIDS Council because we knew that people were going to them instead of doctors. Because when their children were not getting better, they were turning not to the curanderos. We ended up saying, you have to help us. And what we found was that they were very willing to say, we'll do everything we can for your child, but you need to go to this place called the Valley AIDS Council where they have specialists, and they would make the referrals. So they actually built relationships with curanderos and yerberias to make referrals to the Valley AIDS Council. And so it was a symbiotic and healthy relationship, and it was a wonderful relationship. And this actually got a lot of people into treatment that may have otherwise avoided it. And there's a letter here detailing VAC's outreach from 1992, the VAC's outreach, where they talk about going into some of these areas outside the regular channels of AIDS information. So colonias, yerberias, curanderos. And these curanderos would not just do this, they would also come into the hospitals where people were dying from AIDS-related complications, and they would lay their hands on people and pray and rub them with ointments or do the huevo, which is the rubbing of an egg. It's a common Mexican-American curanderismo practice. And all that because either their faith or their understanding was that you couldn't get it that way. But they were willing to touch our patients when even doctors wouldn't. And that brought people comfort, right? Even if there wasn't necessarily a measurable medical benefit to being rubbed with an ointment or having a curandero lay their hands on you or rub an egg all over your body, there was a calm that came with that, right? And it might help people with their feelings of isolation to know that someone was willing to touch them and be with them when even the nurses and the doctors might not be willing to, right? So there was a benefit to engaging with these curanderos in the education side, but there was also a benefit to incorporating them into the treatment side because it helped a lot of people feel less alone and feel more comforted, which can be just as important as a biomedical intervention. And I wanted to add this quote, which I think is really powerful, about why curanderismo is still so popular in a lot of Mexican and Mexican-American communities. This is from the book Curandero Conversations. It says, this is one of the reasons why curanderos are still necessary. They heal our cultural selves. And that can be just as important, right, as healing your body and your from a Western medical perspective. So tips for building culturally inclusive efforts, and we'll end with this, really quickly. Remember, having members of the communities you serve, collecting complex demographic data to be aware of the communities you are serving. This can include race, religion, and language. Consult with members of the community you serve. Write out a plan for cultural inclusion to ensure accountability. Check in regularly to ensure cultural awareness is being achieved. Hold yourself accountable. And a lot of times there's an emphasis on cultural competency, like learning as much as you can about a separate culture, but that tends to reinforce stereotypes. It's it stops us from viewing cultures as dynamic and diverse. There are a lot of different people within a single culture. And so learning about a culture as if it's like something you can learn through flashcards is something you'll probably never be able to achieve, right? There are a lot of aspects of a culture that we may never understand as outsiders as well. And so cultural competency is, a lot of us are viewing that concept as more limited. And there's been a move to something called cultural humility, which encourages you to understand that learning about other cultures and working with other cultures is a lifelong process that you may never finalize or reach. There's not like a final exam that you can ace and know everything about working with Burmese culture, for example, or Korean culture. It acknowledges that you can never understand all of the complexities of a culture that's not your own. It presents distinct cultures as dynamic and complex entities that go beyond stereotyping and biases. And it encourages you to look at your own biases and limitations and blind spots and understand that you yourself also have a culture. And that's really important. I worked with a lot of people when I did refugee resettlement who were white Americans who would, look at, we would be invited to cultural celebrations in the community, or someone would bring us a gift and they would say, I wish I had a culture. And, I'd have to be the one that was like, you do have a culture. And this is what you eat during Thanksgiving. And this is what you're going to do when you get married. And that's a culture. But if you're part of the dominant culture, a lot of times you see yourself as the default. And it's hard for you to see yourself as somebody who also has a culture that can come with its own blind spots and limitations and challenges. Um, so just we're going to end with this idea of cultural strengths, which again can be its own entire college course. But it's just reframing things that can sometimes be viewed in a negative light or through stereotypes as potential strengths. So, for example, instead of talking about a community being closed off or insular or not trusting outsiders, that can be reframed as a community having a strong support system that they can rely on in family and community. There's a deep level of trust in the community that can be tapped into once you build trust to spread important messages. Um, Describing people as backwards or old-fashioned or hesitant to adopt new beliefs is very much a deficit-based perspective, but I've heard people refer to populations like that they work with. A way to reframe it in terms of strength-based is that they're deeply rooted in tradition, that they have strongly held cultural beliefs that have allowed for resilience through challenges, and that those are things that should be acknowledged and drawn upon instead of erased or, ignored. Um, there's people, people say that, oh, this community is difficult to work with because they won't do anything without family or community input. A strength-based way to rephrase that is by saying that these people are collective-minded and that there's strength in collaboration. All cultures have challenges, and all cultures also have strengths that they contribute and that we can learn from. And when we're engaging in cross-cultural exchanges, it's really important that we avoid thinking of ourselves as the people who are coming in to save this other culture or educate this other culture, and be willing to be open to this two-way process in which we learn from the clients and communities that we serve to be better advocates.
Wow. Wow, thank you so much, Gabriel. This was outstanding and very insightful. Thank you, thank you. It's obvious that you're very passionate about this topic, and you've made this very valuable for everyone here today. I dropped a link in the chat with our evaluation. If you go back to the other screen, we have a QR code. Please help us by giving your feedback. We make these presentations based on how you rate our. Can you go back to the other side so we can get
Yes,
the
I'm
QR
sorry.
code?
Yeah.
We value your feedback, so please open up the QR code. I also dropped the link in the chat. It's very valuable for us. So if you would like to stick around and ask Gabriel a few questions, they did offer to wait a little bit. So while you fill out the evaluation, if anyone has any questions or any feedback for Gabriel, if you want to write it in the chat,